153rd day of Ukrainian resistance and media center Ukraine Ukrinform working, and we will speak about a very important conversation with Ksenia Voznitsyna, Chief Doctor of Lisova Polyana Veterans Mental Health and Rehabilitation Center of the Ministry of Health of Ukraine. And we will speak about treatment and rehabilitation of the military personnel and veterans. So, Ksenia, floor is yours. And first question, please tell us what your center is doing. Good afternoon. It so happened that I am the team that we were working with in August 2014. We chose to help military personnel veterans in the specialization of so-called invisible wounds. We're treating invisible wounds. It's all related to psychological health of psyche of our defenders in many aspects. And our main goals, our main enemies are that we're overcoming firstly. It's all related to psychological trauma of combat and all the variants of these pathologies. Second group, we are combating consequences of so-called concussion, of the explosive wave of on the cerebrum, because those consequences have impact on psychological and psychiatric health. And third group, we help people who survive through captivity and tortures. How many people have passed through your center since 2014 and the period of active phase of war? And majority of trauma, can you tell the amount, the majority of trauma? Speaking from 2014, my personal patients as neurologist doctors, you can measure them by thousands. And the center, on the basis of Lisova Polyana Hospital, works over 3 years, and in the center, over 2,000 of service people and veterans were treated there. On the 24th of February, all our veterans in one day, they became service people, and all the work that we were conducting until that day, it was focused at returning people to the normal life, to give them a new wind of life, and to leave the war in the past. And now our work is different because we work 3 months with service people that are military people. And our job as therapists, as psychologists, and doctors to give them a resource and motivation to return to combat, or if that is impossible, to treat them further. And those are the main problems. And the categories that I was speaking about, they divide by 1/3. Psychological trauma, from trauma of war, from horrible events that happens there. Second part is the consequence of the wave on the brain, the explosive wave on the cerebrum. And that pathology, it's put on all the others, because almost everybody felt the artillery impact, and Also, there are many people who survived the captivity. They're our patients. And also we have a category of families of defenders that are either held in captivity or perished or killed in action. Also, there are moms and wives of Azov-style defenders who were either captured or killed, and we try to provide them a comprehensive help because it's very difficult for them. If there are any questions, oh, please ask them. I'll ask you how you cooperate with the military. Because to convince commander that you have concussion or psychological trauma, it's not an easy job. How do you get the patients from the military? A lot of word of mouth here, and also our personal contacts with supervisor. We have supervisors. We have 8 years of experience. All our patients, they have years of service, and they have commanders. And pretty often, that's just speaking on the telephone with heads of medics of detachments or with superiors. There's some competence, they require aid, they require help. There is certain progress in this work, and a certain amount of commanders and head of medical services, they understand the problem and they address us with those requests that there is such competent and they have such and such symptoms. Please take the competent. There's a big category of people we take after military hospitals where they go through a specialization period, and then we finalize their rehabilitation because the list of services in our hospital is unique. I'm not afraid to say it because especially in the post-concussion syndrome, only the team of psychological and psychiatry team, we have 12 people on top of regular doctors, and we use additional practices that are used in the world, non-med practices, neurofeedback and transcranial magnetic stimulation, and cognitive training of inter-ear training. We're not just focused on droppers and pills. We use the methods that are accepted in the world and that have the scientific base and complex of means is efficient. Let's speak of tabooed topic as sexual crimes and victims of sexual crimes, sex crimes. I know they are rehabilitated as well, the sex crimes victims. What are the specific works of those patients? And there were not many patients, to be honest with you, and it was more of in March, April, when we were not working because our hospital was in a serious zone and it was all evacuated. And then our psychological unit was involved that was working online on those requests, even working with people that were in occupied areas, the females that were in the occupation. And that work is very difficult. There's all techniques. There's no point to speak about them because I'm a neurologist, doctors, and my colleagues, therapists, were doing this, psychotherapists. It's a direction of psychotherapy with people who survived captivity. You have to have certain skills and tools for that. I have a question, yes? Valentin Ukrinform, as you evaluate, we have enough of specialists in Ukraine who will rehabilitate veterans psychologically? And do have to additionally train such specialists? Of course, we'll lack specialists considering the scale of traumas and traumatic events, but I will tell you that there is a common opinion that among all the countries in the world that we'll never have enough specialists for health of psychology, psychiatric health. We have this initial basic direction of work, psychosocial support, not specialized treatment and specialized help with a special therapist or psychologist, but accompanying self-help movement of support and this has to be developed right now. What is done? Actually, the first framework of First Lady program that he's operating on the social psychological support. Of course, we have to train specialists. That is done. A lot of them are trained. Even amount of people in Israeli, some amount of people is trained in Israeli, and a lot of help is done by international organizations to finalize the training, and the training is conducted also not only by psychologists, by the Ministry of Social Policy, Ministry of Education, and only among the those who work in education. There are many psychologists, but they have to have additional skills on psychological aid, on redirection of children if there are certain problems. So that's a lasting process. Thank you. MOH plans to implement international classification functioning, and rehabilitation programs have to be developed depending on the requirements of certain patients. Do you have capabilities for that? Yes, considering that we took this narrow legislation of psychiatric health, each person has to make an individual plan of rehabilitation according to the capabilities, according to the request, according to problems that the person has. And multidisciplinary team is very important here. That needs to be used MKF. In our institution, one patient has 5 or 6 specialists: neurologist, psychotherapist, physical therapist, and social employee, also social worker, neuropsychologist, and that's it's a powerful resource to restore health. I'll ask. Ministry said that we have 5 million people. They said need some psychological help, and speaking about 3 million people need medical aid. Those are quite impressive numbers, but for a community, what will change for the community? Because we'll have a lot of people with mental trauma, with psychotrauma. What has to happen? What has to change in the community? I like to speak on this topic a lot because having said that, in our institution, we implement our dream on disseminating knowledge and by uniting the specialists. We started a training center, founded a training center, or base. It's a hub where we accumulate knowledge, and we conduct a lot of work, not with specialists, but we train the community, the social workers, lawyers, even the library workers, people who work in communities, territorial communities, because all our work will be the hindrance will by non-acceptance of veterans by the community. It's compulsory. It has to be for such person to socialize and renew to come back to the peaceful life. It has to be accepted by community. A lot of work need to be done with on working with stigmas, and a lot of social work need to be done of social advertisement and popularization and awareness campaigns with such people. Because I'm saying that people who survived or that traumatic experience, they live through the experience, they are owners of unique experience that with a proper processing and proper rehabilitation will be a push to new capabilities. And the role of community is very, very important, and we have to work a lot on this, regretfully. Thank you, Ksenia Voznitsyna with us, Chief Doctor of Psychiatry and Rehabilitation Center, Lisova Polyana. See ya.